Hello students, today we will discuss an operative procedure briefly, which is very interesting. But just before that, we will quickly go through the MCQs of the day. So answer the MCQ, what the specimen is likely to be, A, B, C, D. Put the right answer in the comment box. I'll appreciate your answer and acknowledge and put the right answer later. Answer what this clinical test is. Again, A, B, C, D. Find out, put the right answer in the comment box. I appreciate your answer. And before going through the discussion, I request all of you to subscribe my YouTube channel, share with your friends and colleagues and press the bell, and also daily view the lectures which will update your knowledge about images, x-rays, specimens, operative procedure, clinical cases, and so on, for briefly about 5 to 10 minutes. And also join live session through my YouTube channel once in 2 weeks, where student will present a case lively, more than 1.5 hours. Interactive session will be there, how to present the case, how to go ahead with the discussion, which will make you to face the exam, practical exam, very properly and very easily. So with an interactive session. So please join that live session whenever it is there, and you will get a certificate of joining, which will be very, very useful for your in future career. Again, request you to subscribe my YouTube channel. Now, what this operative procedure is, look at that. Here, ear is there. There is a swelling in front of the ear, and there's a mark you can make out. There's an incision mark, of course. Patient is under general anesthesia, and this is raised adequately, and we have gone through a swelling here, very typically over the cartilage there, and after removal, this is the look. And this is the suture which are placed in front of the tragus actually. This is the specimen, probably around 3 centimeters in size. And this is preauricular sinus swelling or preauricular swelling. There are so many differential levels you can think here. Parotid swelling, where curtain sign is positive, preauricular lymph node, simple sebaceous cyst, lipoma, neurofibroma also can be possible. But this patient had a earlier recurrent discharge and swelling appearance. So that makes you sure that clinically it is a preauricular swelling, sinus forming swelling. And of course, MRI, if you do it, confirm the diagnosis. You can put a needle and confirm that it is not a major issue like a neoplastic condition. After that, under general anesthesia, not under local anesthesia, you have to make an incision like what I have shown here, and carefully dissect without rupturing the sit capsule, and remove the capsule entirely. Of course, cartilage should not injure, and place the suture. Entire capsule removal is very, very because it attaches somewhere into the cartilage, because they arise from the ear tubercles as a congenital entity. It is congenital entity, not acquired entity. So from the ear tubercles. So that is the point which you have to remember always. And that is under GI you have to exercise it. Otherwise, if you don't remove capsule properly, recurrence is likely to occur. It's more difficult to manage because adhesions will be there, may injure the cartilage. Then you do a second surgery. So excision, as a ear tubercles arising from the ear tubercles as a congenital entity, I already told, as a congenital entity arising from the ear tubercles. This is the point which you have to remember. Already told differential diagnosis, you have to think of curtain sign that day, all other clinical methods, pinching sign, curtain sign, mobility in both direction. So everything is important when you examine such patient. Of course, MRI, FNEC concludes the diagnosis. Treatment is surgery, excision, complete excision under general anesthesia. That point you have to always remember. For detail, please refer my manual of surgery and clinical method in surgery, which will give you a very good idea about this subject as such. And quotation of the day is, your connections should be meaningful. With the viewer you are connected, it should be meaningful. You got to have some understanding also. That is very important as far as surgery is considered. And again, students, please have my clinical methods in surgery, which gives extensive clinical knowledge with lot of clinical photos, with examination of hernia, thyroid, breast, abdomen examination, urology examination, specialty examination, briefly orthopedic, with the ulcer, swelling, varicose vein, peripheral artery disease, general examination, with a lot of photos. And each chapter has got a QR code. If you click that, you get a video of how to examine. It will clearly give the idea how to examine lively, you can see, so that you can make use of it in your future examination. Also, when you face the exam as such, but it is the only clinical examination book. Of course, differential diagnosis is there in a tabular form, but no management. Again, where it got instrument and specimen also. It's a differential in the tabular form, so again very, very useful. And videos, lectures through QR code also very, very useful. And it's a detailed lot of photos which will make you to understand clinical conditions very easily because of photographic memory. And my manual of surgery is extensively used all over the world, which covers all CBM syllabus, general surgery too, specialties, GI surgery, thyroid, breast, spleen, liver, and varicose vein, peripheral arterial disease, ulcer swelling, all specialties, everything is covered, and instrument, specimen, orthopedic, anesthesia, adjuvant therapy, with the quotations and footnotes, with the management principles, investigations, concepts, tables, everything is there. A lot of photos and illustrations, and each chapter has got an online connection where MCQs are there. You can always go through the MCQs, which will be helpful to face the exam, degree exam, MBBS and postgraduate, and also MCQs in that, and also NEET exam or any competent exam you can face very easily as far as surgical subject is concerned if you go through my manual completely, properly with online NEET MCQs and also clinical scenarios. So student, again I request you to join my YouTube channel, subscribe, free it is, and also share with your friends and colleagues to understand surgery in a better way. So students, I hope you have understood this lecture very well. Thank you so much.